Welcome to this webinar on dental health. Did you know that poor oral health is a contributing factor to the development of chronic diseases such as arthritis, diabetes, heart disease, and even cancer? Are your dental problems such as root canals making you sick? In this webinar, I will talk about how root canals and other dental infections could be making you sick. I will also show you how thermography is a valuable assessment tool that can identify dental inflammation. My name is Sharon, and I am a registered homeopath, a holistic nutritionist, and a medical thermographer. I am the founder and clinic director of Thermography Medical Clinic since 2010. I am an interpreter for Thermography Medical Clinic. I was the clinic founder and director of Divine Living, which was a natural health clinic from 2005 to 2022. My philosophy is a personalized, proactive, and preventative approach to healthcare. I just want to put this out there before we begin that although I'm talking about dental health, I am not a dentist. Rather, this webinar is to educate you on how thermography can help to identify if your teeth might be contributing to your health concerns. In this webinar, we are going to discuss how your teeth are connected to your body and how your oral health can provide clues about what is going on with your overall health. I want to talk briefly about lifestyle factors that affect your oral health and as a result will affect your overall health. We will discuss briefly how a root canal is performed and what the consequences may be. Finally, we will get to the most exciting part where we talk about how thermography can show you if you have dental inflammation that may be the underlying cause of other health conditions. Believe it or not, a thermal image of the head is like a roadmap of your health. It's the first image I see when I analyze a study, and it gives me so much insight into what is going on with a person's health. In a head image alone, we may see patterns that indicate digestive stress, kidney adrenal stress, cardiovascular stress, sinus inflammation, lymphatic system stress, vascular inflammation, thyroid stress, musculoskeletal issues. But today we are going to talk about dental inflammation or dental infection and how your teeth could be making you sick. So how do our teeth affect our health? And how does our health affect our teeth? And why does it matter? It matters because each tooth is related to an organ or area of the spine. When an organ or system becomes diseased or infected, it's not unheard of that the tooth associated with the part of the body will express some type of symptom as well. Maybe a toothache, or weakness, or actual infection. The moral of the story here is that your organs can be affected by poor dental health, and your dental health can be affected by poor organ health. The meridian tooth chart is based on acupuncture meridians, pathways of energy that span across interrelated body parts, glands, and tissues. Each tooth is associated with a particular meridian through which energy flows. By referring to this meridian tooth chart, you can see the connection between your teeth and your organs. Your mouth is a window to your health. Ask any dentist and they will likely tell you that taking a look inside a person's mouth gives them insight into a person's health status. The condition of a person's teeth may also point to problems such as poor diet, such as vitamin and mineral deficiency. They can likely tell by the smell of your breath how healthy your mouth is in terms of cleanliness. By looking at your teeth, dentists can tell if you grind your teeth or clench your jaw due to high stress levels. Poor oral health or dental decay may also indicate organ system stress, underlying disease, or bacterial imbalance in the body. A dentist can tell by the color of your teeth if you're a smoker, you consume coffee or tea, or drink alcohol. Most of us have been told that to have healthy teeth, we must brush and floss every day, but there are other things that we should be doing to keep up with our oral health. We need to take care of the digestive system, and by this, I mean keeping the bacterial balance of our gut in check. We know that poor digestive health can be a direct cause of poor dental health. It is important to avoid sugar and processed foods since these can have inflammatory effects that can ultimately weaken our teeth. Managing stress is also critical since prolonged stress can lead to teeth clenching. Teeth clenching can sometimes be a compensation response caused by emotional stress or musculoskeletal imbalances in the upper spine. Over time, teeth clenching can weaken the teeth and cause inflammation in the gums, allowing bacteria to accumulate in the mouth. Nicotine use can also affect oral health. The toxins from nicotine cause inflammation, which can allow bacteria to become trapped under the gums. Many prescription or over-the-counter medications and even recreational drugs can make the body acidic, which can lead to inflammation in the mouth, causing bacteria to reside in the gums. Did you know that poor oral health not only causes bad breath, but can also lead to chronic illness? That's why it's so important to take care of your dental health. It's well known that the following conditions can be affected by poor oral health. So often we miss putting together the cause and effect pieces of our health. Patients develop symptoms or disease, and they are treated for those symptoms or disease. And sadly, the underlying cause of symptoms or disease are rarely discovered, so patients don't get better. That's the value that thermography has. Thermography can help point you in the right direction and show you the underlying cause of your symptoms or disease. So if you have any of the following conditions, cardiovascular disease, digestive issues, cognitive decline, arthritis, fibromyalgia, or any other chronic inflammatory condition, if you have cancer, or even if you have pregnancy-related complications, immune system disorders, it may be time to look at your oral health with thermography. But how can our teeth be making you sick? How can the dental bacteria affect more than just your oral health? Bacteria from the mouth can travel throughout the blood and your lymph system to other parts of the body. For some people, bacteria from the mouth is the underlying cause of their health conditions. There is now a consensus that chronic inflammation is the underlying cause to chronic disease, and so inflammation needs to be mitigated. However, what is more important to address is the underlying cause of inflammation, which could be from dental bacteria. Dental bacteria can lead to inflammation. Chronic unresolved inflammation can eventually compromise the immune system, and a weakened immune system allows the disease process to set in. I want to take a moment and talk about Weston Price. Weston Price was a dentist known for his theories relating to nutrition, dental health, and physical health. He studied how bacteria from teeth impact the health of the whole body, so he conducted an experiment. Dr. Price took a tooth from a person who recently died from a heart attack and embedded the tip of that tooth root under the skin of a rabbit. This rabbit died of a heart attack within 2 weeks. He then removed the tooth from the now dead rabbit and placed it under the skin of a second rabbit. This rabbit also died of a heart attack within 2 weeks. He continued this procedure using the same tooth with 100 rabbits. All 100 rabbits died of a heart attack within 2 weeks. What can we conclude by this? Sadly, first, a lot of rabbits died, so we could learn the correlation between dental pathology and increased cardiovascular disease. Bacteria from dental issues, known or unknown, can travel through the bloodstream and lymphatic system, causing inflammation. We know that inflammation leads to a compromised immune system, and a compromised immune system results in disease. So what is a root canal? Many people are familiar with a root canal procedure because they've had one. But there is a lot of information that people don't know about what a root canal is and what it means for your health long term if you have one. First of all, a root canal is controversial. You may not be aware, but there is a lot of controversy surrounding root canals. Many dentists are no longer performing root canals, and scientific research is beginning to shed light on the dangers of the practice. Yet, dental associations and other professional organizations insist they are safe. So what is the truth about root canals? Root canal is surgery. A root canal is a procedure in which the dead tissue and bacteria from a deep cavity is removed before being filled. The procedure is done when the cavity goes down into the root, and the idea behind a root canal is to actually preserve the tooth, which is usually desirable for aesthetic appearances and effective chewing. Even though the tooth remains, the tooth is considered dead. A root canal is not always successful. Scientific research has revealed that not all of the bacteria from the infected area is removed through a root canal. About 40% of bacteria is removed in most cases. In every case studied by researchers, at least some bacteria remained after the root canal. We also know that root canals are dangerous, and here's why. While this procedure eliminates the pain for patients because the nerve in the tooth is removed, it cannot completely remove toxins and bacteria. So these bacteria are free to grow and multiply in the surrounding tooth. And since there is no nerve remaining in the tooth, patients don't sense pain if the infection grows. These bacteria can enter the bloodstream to cause systemic problems throughout your entire body. Also, the material used in filling of the root canal can stimulate an immune response, which can cause patients to feel less than their best, and cystic lesions and scar tissue can form at the site of the root canal, which can also affect your long-term oral health. So what are the alternative treatment options available to having a root canal? Avoiding the need for a root canal is the best alternative. However, that's not always possible. Your greatest chance of never needing a root canal is to maintain good cleaning and hygiene practices. But in many cases, extracting the tooth with a simple and painless procedure can be a great choice as it fully eliminates the source of infection. So how can thermography help? Let's take a look at what we see with thermography. Teeth that have a root canal in the front teeth may present with a cold pattern observed in this first image. This indicates the tooth is dead due to the nerve being removed. However, bacteria can still reside in the dead tooth and travel through the body. According to research, all root canals can have lingering infection that can cause systemic disease. Let's take a look at what we see with thermography when we evaluate a person's health. We can see in the following examples how dental infection may be the underlying cause. This client came for 3 years for just a breast study, and every year the inflammation in the left breast increased. She had an ultrasound every year to monitor the suspicious area in the left breast, and finally I convinced her to have an upper body study done to see if we could identify the source of the left breast inflammation. Well, look what the upper body study revealed: dental infection on the left side. In this study, we can see how bacteria travels. We see the dental infection on the left side of the mouth, the breast inflammation on the left side, and in the abdomen, we see patterns that indicate bacterial imbalance, kidney stress, and adrenal stress. The kidney stress is likely due to an overwhelming amount of toxins in the body, and the adrenal stress, or the fight or flight response, is how the body responds to stressors, which in this case is dental bacteria. This patient needs to see a dentist to take care of her infected tooth. These patients reported unresolved thyroid dysfunction even after taking medication for several years. Could bacteria from the teeth be the underlying cause? Research shows that dental infections may trigger inflammation in the body, which is the body's natural response to injury. This inflammation damages the thyroid cells, therefore causing thyroid dysfunction. This person complained of chronic joint pain, but her thermography study didn't indicate any musculoskeletal issues at all. Bacteria from infection in the mouth can travel to other areas of the body, such as the joints. Bacteria in the mouth may also trigger an immune response in the body that may lead to conditions such as arthritis or fibromyalgia. So if you suffer from any of these chronic inflammatory conditions, you may want to have your oral health checked out through thermography. This patient had heart palpitations with no known cause. Could it be dental infection? It is certainly worth investigating. We know from the experiment that Dr. West and Price conducted that dental bacteria has a direct correlation to heart disease. You can see in the images above, in the first image, there's inflammation on the right side of the mouth. The second image shows inflammation related to the carotid artery. The third image simply shows how inflammation from the dental bacteria is traveling through the lymphatic system. Here is a before and after example. This patient complained of chronic digestive issues, and after trying different diets and supplementation protocols, she decided to investigate the underlying cause. She discovered through thermography that she had a dental infection on the right side in a tooth that had a previous root canal. The images on the first row show dental infection on the right side. In the second image on the first row, you can see how there's inflammation along the lymph drainage pathways in the neck. And in the third image, in the first row, the patterns in the torso indicate inflammation caused by bacteria in the body. Bacterial imbalance always has a source, and we can identify that source with thermography. She went to her dentist and had the tooth extracted. She came back for a follow-up thermography 6 months later, and you can see how her body has responded in a very positive way. In the second row of images, you can see the reduction in inflammation on the right side of the mouth. In the second image, you can see the reduction of inflammation related to the lymph drainage pathways in the neck. And in the third image, in the second row, you can see that those scattered hyperthermic patterns have decreased, meaning there is less inflammation. So, why don't you let thermography help you? Thermography is the only assessment tool that can show you if you have dental inflammation, and it can show you how it is affecting your health. Let your thermal map be your roadmap to better health. Are you concerned about your health? To learn more about how thermography can help you, the following videos are available on our website, thermography.medicalclinic.com, and our YouTube channel. For more information, you can visit our website, thermography.medicalclinic.com, and follow us on Facebook and Instagram.